World War II had just ended. Black and white TVs were still a novelty, and the world's first antibiotic, penicillin, had been making headlines as a modern medical miracle. Meanwhile, in a tiny garage in Minneapolis, an electrical engineering student, Earl Bakken, quietly began repairing hospital equipment with his brother-in-law, Palmer Hermansley. The two named their humble little company Medtronic, and it wasn't long before doctors and nurses recognized their special skills. "Could you modify this monitor?" the nurses would ask. "Could you build us a respirator?" the doctors would inquire. And the two always did. One day, a request came that transformed Medtronic from a small repair company into what would eventually become a medical technology powerhouse. Famed cardiac surgeon Dr. Walter Lillehei asked Earl to develop a battery-operated pacemaker. Up until then, patients with irregular heart rates had to plug their large external pacemakers into wall outlets, limiting their mobility and making them vulnerable to power outages. Earl developed an innovative battery-operated pacemaker that was so small it could be worn by even the youngest patients. The device revolutionized cardiac care and put Medtronic on the map. For Earl, seeing how his work transformed patients' lives, how his devices helped to alleviate pain, restore health, and extend life, was so important that he transformed that driving force into a formal mission. The same mission continues to guide our work today. In fact, not one word has changed over the years. Even as Medtronic grew to become a global leader with therapies and tools to treat many of the world's most pressing healthcare conditions, our passion for learning, collaborating, creating, and healing continued. Because nothing is more important than the people who depend on us to make a difference.
We're here with Mike from Medtronic, and we're going to be asking him 5 simple questions pertaining to the company that he's employed with today. Mike, would you mind giving us a brief overview of the business?
Yeah, the company I work for is Medtronic. We're based out of Minneapolis, Minnesota. We do medical technology. Includes things like pacemakers, heart valves, drug-eluting stents, that kind of thing.
Does your company use?
We use a lot of technologies. In the IT department, we're rolling to Cisco IP telephony for cost savings. Out in our distribution center, we use wireless handheld scanners for order fulfillment and also to move inventory from location to location.
mind mentioning some business strategies?
With how saturated the medical device field is, a lot of what we do now is more geared towards expanding into OUS, outside the United States, into Asia, Latin America, emerging countries in Africa, Europe.
Infrastructure help support business strategy?
Well, the way our infrastructure is set up, anywhere in the world, as long as you're in a Medtronic location, you have the same access as you would here in the States. You can access all of our systems, all of our warehouses, all of the data that we have, and communication is instant.
Do you think that there are any technologies that are emerging that Medtronic should consider to achieve a more competitive advantage?
One thing we could do to help drive our internal costs down is the use of RFID tags in our warehouses. It's something that we don't do currently. A lot of stuff we still have to scan things in, which eliminates the human error when you're scanning the devices instead of having to manually enter the codes. But RFID would be something that could be done automatically without any human interaction at all.
Because nothing is more important than protecting his life, extending her life, creating the opportunity for moments lived to the fullest. Because nothing should stand in the way of the human potential to dream, to create, to strive, to achieve miracles. Because nothing in medicine is more important than healing, understanding, caring. Nothing is more important than keeping real people in mind. Because the art of medicine must constantly move forward to help someone make the most of living. Because there is no such thing as just another patient. Because we can help people we care about touch lives in which we can make a real difference. Because nothing is more important than helping someone in need. Finding a better way. Coming up with new answers. Creating new possibilities for remarkable lifetimes. Because nothing is more important than the people who depend on us to make a difference. Medtronic.